I thought maybe you'd want to hear about my perspective on medical care and health, but I'm going to sidestep that and talk about our health as a nation and what factors influence that. And so I want to look at health outcomes for rich nations and where United States stands in that. I'm going to present an avalanche of what I call killer facts, so be prepared for that. Then I want to discuss reasons for the findings and suggest that inequality that we have so much of in this country is actually killing us. And maybe I'll get to talk a little bit about medical care later on. But about, 15 years ago, as I grappled with these ideas, I said, what if health were an Olympic event? You know, we competed in the Sochi Olympics, and we won the most medals since the Games started in 1922. Suppose health were an Olympic event, and suppose the actual race was in life expectancy, length of life. And how would the United States fare in that race? And let's use life expectancy let's use life expectancy calculated for 2013 as reported by the United Nations Human Development Report. And it lists each country with its life expectancy. And if United States if we had a health Olympics, how many would give us the gold medal? How many would put us in the top 5? Top 10? 1. 11 to 15? 1. 16 to 20? 1, 2, 3, 4, 5. 26. 21 to 25? 1. 26 to 30? 1, 2, 3, 4. Below 30? Okay, 3 for below 30. So these are the data from the United Nations Human Development Report. Okay. Hooray. So here we are at 35th. That is, there are 34 entities the United Nations calls countries that have longer lives than we do. So, first of all, do you believe this? Well, you could say, I can put anything into a spreadsheet and create a graph. So, but everywhere you go and look at tabulations of countries and their life expectancy, these put us in the best light. If you go to the CIA World Rankings website, we're 42nd. They count tiny little things as countries that, UN doesn't. So, what are we going to do? This puts us about 4.5 years behind the longest lived country. Is that 4.5 years drooling in a nursing home? What does that 4.5 years difference really mean? As a doctor, if I have a kid with a temperature of 42 and normal's 37, those 5 degrees are bad. I'm going to act quickly. We're almost, that's almost the equivalent of our being behind Japan, but is it meaningful? So one way to address this question is to say, well, suppose we did the calculations for 2001 with and without September 11th. How much difference would it make? A lot?
Probably not.
Probably not. Less than 1/100th of a year. New York City did the calculations, the health department, with and without September 11th, just for the city itself, and it made a 1/10 of a year difference for men and essentially none for women. So how big is this difference? Well, suppose we eradicated our leading killer, which is cardiovascular disease, right? How many life expectancy years would we gain? About 3.5. So if we did something that we would think a miracle, we still wouldn't be the longest lived country in the world. And I take length of life as a measure of health because, I used to work in the ER here from 1986 to 92. As an ER doc, it was the easiest diagnosis for me to make, death. And so I like death rates because it's hard to fudge. Anyway, so this difference in life expectancy is a tremendous disease-oriented difference. Now, maybe we've always been 35th. It just doesn't matter. Health isn't important in the United States. It's other things. Please, interrupt me.
I have been working on putting together statistics for Healthcare for All Washington, and we were told by a number of people that life expectancy is not a good number to use because it's measured so differently in different countries that start measuring at different ages, like a few months or a few weeks.
Okay.
So what's
Okay, so let me speak to that when I get to infant mortality. The only difference is what you consider a live birth. And here in the ER, if something came out and it made any struggles of life, that was a live birth. In France, if it died in the first 24 hours, that was a stillborn. So there are these differences. They don't actually impact this figure, and I'll show you that later.
Did they talk about the quality of life?
Okay, that's a whole other issue which there are disability-adjusted life expectancy measures and healthy life expectancy measures that factor in disability. And it requires a judgment as to whether you're better off not having a leg or not having an eye, whether you're better off bipolar or schizophrenic. If you, and WHO, World Health Organization, does these calculations every year, the chart would be the same. We're about the same place in healthy life expectancy as we are in just plain old life expectancy. Now, in the 1950s, we were somewhere in the top 5. I say somewhere because we don't have good data for all countries. But we know we were up there. When I went to medical school in 1970, we were here, 17th. When I went to public health school in 1992, we were 22nd. And last year, we were 34th. That is, these numbers keep increasing every year. Every year, they report that Americans are now living longer than ever before, but they never report how we do compared to other countries. So what happens is we live longer lives, but other countries see more rapid health improvements, and I'll show you what I mean by that in a minute. So the question is, why? Any thoughts on why we are so far behind the other countries in mortality, in disease-attributable deaths? Yes?
Well, we have a lot of people that are left out of services and healthy living, food, nutrition.
Okay, so we have some bad behaviors and people are left out. Yes? Poverty. Okay. Yes?
Accidental deaths, car crashes, gun shootings, and the like.
Okay, let me show some data on that. Yes, sir?
Number of deaths in military-oriented type things like PTSD.
Okay.
We
Suicides.
more wars than the rest of those countries.
Okay.
Expand on poverty and say more disparity in wealth than absolute poverty.
Okay. Well, we have more poverty than any other rich country. We also have a bigger income gap than all the other rich countries, and that's where I'm heading. In terms of individual personal behaviors, it's hard to discount the ones that you just mentioned, but let me pick an egregious behavior, cigarette smoking. Out of all the countries on this list, which country has the lowest prevalence of men smoking? United States.
we do, I think.
Right. Which country on this list has the highest prevalence of men smoking? Japan.
Okay.
France is right up there, but Japan's a little higher. Twice as many men smoke per capita in Japan as here.
Do they have a big tobacco lobby in Tokyo?
They do. Actually, the government owns 2/3 of all first of all, the tobacco industry was national until 1986 when it was privatized, and the government has to own 2/3 of all the shares. And so the government makes a lot of money off smoking. Now, smoking is declining both here and there, but it's still, you go to Japan and that's all you see is men puffing away. You stop in Narita Airport and there are these little cubicles where the men are in there just puffing as fast as they can. Yes?
I heard an interesting stat when I was checking out things. You don't have many Asian countries, well, you have a few, but that the Asians' batting order of death is changed from or different from the European, which is I believe, heart attack, cancer, organ failure. There's organ failure moves up to top because they like to do a little bit of drinking. But
yeah, so the leading cause of death in Japan is actually cancer, and heart diseases too, and organ failure is up there. Yeah, so when you get into causes of death, the numbers vary a little bit, and you can ask the question: how accurate are the death causes, the reporting of diseases that you die from? And I used to have to fill out, death certificates here, and I wasn't always sure. So not personal behaviors, not health care, because we spend the most on health care, twice as much as any other country per capita and so on. But that's a hard thing for doctors, and I don't want to be seen as a total heretic, but I'm going to now give you an avalanche of what I call killer facts. That's just one. So you asked about, how about young people? So these are mortality rates for 10 to 24-year-olds per 100,000. 2009. Of course, it'd be surprising if our mortality rates for young people weren't the highest among all the rich countries. So they're right up there. And notice the number one cause. Look at this green bar. Traffic crashes.
Number 2 is violence.
Number 2 is violence. Look at that. That's so much bigger than all these others. So, your points are well taken. Why is it we have so many traffic crash deaths in the United States? Are our cars so poorly engineered? Are the roads so poorly constructed?
It's the loose nuts behind the wheel.
Yeah, loose nuts behind wheels. Okay.
Big billboards.
Big billboards. Okay. Now, suicide, people often talk about. Other countries, Japan has them. Where's Japan? Japan doesn't have that many suicides. Well, it does. It has more than we do. And then this is everything else, all the various diseases and things like that. So our youth are winning the gold medal in the health deaths. Let's take another measure. Okay, so these are young people. We've looked at overall length of life. We've looked at young people. Suppose you're a 15-year-old girl in the United States. What are your chances of dying before reaching age 60, dying in the prime of life? How does that compare with, say, a 15-year-old girl in the other rich countries? Well, you'd now know that a 15-year-old girl is going to die, has a greater chance of death than a 15-year-old before reaching age 60 than a girl in all the other rich countries, so I won't show you that data. I'm going to pick a country that's a poor country, Sri Lanka. Okay? What is the probability that a 15-year-old girl will die before reaching age 60 in the United States versus Sri Lanka? So these are the graphs from 1970 to 2010. Probability of dying. Back in 1970, the Sri Lankan girl had a 23% greater chance of dying. Now the American girl has a 13% greater chance of dying before reaching age 60. Now, these data are taken from an Institute for Health Metrics and Evaluation paper in The Lancet. I mean, I'm not making any of this stuff up. You can find them in WHO, the World Health Report. So what do we know about the status of women in Sri Lanka?
Very little.
Okay. Which was the first country that had an elected female head of state?
Not India. It's in Africa.
No, it was Sri Lanka in 1958 with Prime Minister Bandaranaike. We still haven't had an elected female head of state. So when it comes to the status of women, I think Sri Lanka is different than the United States in some fundamental ways. Something else we know of that's very important for health is early life factors. And what do we advise moms who've just had a baby? Breastfeed, right? So what are the rates of, so on WHO, or everybody says exclusive breastfeeding for 6 months. What proportion of American women say, because we don't have hero cameras on them, say that they exclusively breastfeed for 6 months? Turns out to be 16%. And the CDC, which reports this, is quite pleased because that's an increase. How about in Sri Lanka? 78%. Exclusively breastfeed. And at a year and a half, something like 30 or 40% are still breastfeeding. So very different early life circumstances. Let's pick pick a 15-year-old man, and let's make the comparison country Tunisia, where the Arab Spring began. Same picture. Just the curves crossed a little earlier. So when it comes to dying in the prime of life, we seem to do too well at that. This adult mortality figure. Suppose you make it to age 50. How many years of life do you have left? What's life expectancy at age 50? In other words, you can calculate life expectancy at any year. So let's look at life expectancy at age 50. And let's just look at a few countries so that, we're looking at pairs here. The first graph had 35 too many. And let's look at women. So how many years of life does a 50-year-old woman have in the United States compared to these other countries? Australia, Italy, Spain, France, and Japan. From 1955 to 2007. Notice in 1955, heavy bar, American women had more years of life to look forward to than in the other countries, and Japanese women were last. Look at this. Nobody touches Japanese women for health. They're the healthiest population on the planet. And look what happened. American women were in the race until about 1980, and they started falling behind. Why?
Women's liberation.
Women's liberation. So what does that mean? Expound on that.
They started working in
Exactly.
large numbers.
Yes.
So they left their children
Yes.
to take care of others, and they're stressed.
And they're stressed.
Sorry, who do you mean by they?
The women. Women.
We're Americans down there.
The other women?
Well, I think in the U.S. we certainly have worked at allowing women to be more active in the workforce.
But these other countries, not Japan, but France, Australia, Italy, women will go to work there too. What's the difference?
It's probably a lot more single moms having a lot more stress in life.
Okay. Yeah, I think you have to consider that stress is the 21st century tobacco. Mm-hmm. Stress permeates so many lives in this country. Please.
I was just going to say that in this country, in the, 80s mostly, women entered the workforce not so much by choice as because they had to in order to have.
Right. So women started work. What happened? Typically wages in this country have been rising in inflation-adjusted dollars along with productivity. They rose until about 1970, and then, although productivity has increased, wages in inflation-adjusted dollars have been flat. So how do we cope?
They're actually lower.
Okay. Lower, I'm not going to quibble. So we put women to work, we put children to work. If the employer wouldn't pay you, you borrowed your salary against credit cards and then against home equity. Imagine that. People just said, well, if the company's not going to pay me, I'm going to borrow my salary. What nonsense is that? So the expectations on women became phenomenal. Think about it. A woman has to be successful in the career world. She has to be a devoted wife, a caring soccer mom. She has to have the looks of a supermodel, the physique of a jock, and she has to be a porn star. That's really hard. We men are the same old jerks we've always been. Nothing more is expected of us. The expectations in women in this country are unachievable. Yeah, there's a whole bunch of issues here, but I think this portrays something very critical about, for men it's not so bad. In other words, if I did the graph for men, it wouldn't look quite so bad. And I can swamp you with too many graphs, so you have to take my word for that. So something's going on in this country. Now you mentioned, early life. So this is CDC Health 2013, the latest report from the CDC. And this is the table that gives infant mortality rates in international rankings from 1960 up to 2010. And then they list, so they have all the numbers for all these rich countries by and large. And in 1960, our ranking on infant mortality rate was 11. Now it's 26. So, although infant mortality rates are going down in this country, they're going down faster in all the other countries. So much so that, remember, Sweden is one of the, well, you saw Sweden in the documentary, and Sweden has one of the best health outcomes. Suppose we had Sweden's infant mortality rate. Okay, ours is about 6.1 and Sweden's is 2 point something or other, 2.1. If we had Sweden's infant mortality rate, which shows what's achievable, every day 47 fewer babies would die. There would be 47 fewer infant deaths in this country every day if we had Sweden's infant mortality rate. And nobody gets upset about it. You know, I just put here the little spreadsheet calculation to show how you derive that. So we seem to tolerate a lot of mortality that we shouldn't have to. Nobody even knows about this stuff. So this is maternal mortality. So I said that our mortality rates are going lower and lower. There's only one mortality rate that is rising, and that's maternal mortality. Our maternal mortality, we had, by the way, in 1951-53, the lowest maternal mortality ratio of all countries. From 1990, and since then, I show you a page from my medical school notes, but in the interest of not overwhelming you, I won't. From 1995 to the last couple of years, our maternal mortality rate has increased 50%. It's continuing to rise. And, you know, why? It's not like they don't have...
Welfare reform.
Welfare reform, yes. It's stress. And there's a lot of studies on stress. And I'm not going to talk much about... health disparities or health inequalities, but this is in California maternal mortality rates for African Americans versus whites and everybody and Hispanics. But this shows you that African Americans pay the price for everything much, much worse than anybody else. So maternal mortality is going up. Averages tend to hide a lot of inequalities. Is health in the United States now starting to decline? It is for getting worse. So I want you to consider that we may be close to reaching the end of the health improvements, because if you look at county level data from this decade, the most recent decade, this was published last year, where there's red, maternal age-adjusted mortality rates for women less than 75 years. Mortality is going up in the red counties. That's over 40% of U.S. counties are seeing an increase in mortality for women, not for men, about 4 or 5% for men. So it's consistent with the other graph I showed you, namely something is happening to women in this country, and it's actually affecting all of our health. Is there anything I've said so far that you won't find in the Institute of Medicine's report released last year with the very good title, U.S. Health and International Perspective, Shorter Lives, Poorer Health? Says it all. They write, for many years Americans have been dying at younger ages than people in almost all other high-income countries, and they present all this data. Now, many of us would think that these data don't apply to us, because I eat right, I exercise, I don't smoke, I see my doctor, blah, blah, blah. So they write up front, Americans with healthy behaviors are those who are white, insured, college-educated, upper-income groups appear to be in worse health than comparison groups in similar countries. You can't behavioralize yourself out of this. It applies to all of us. That's the Institute of Medicine's report. I mean, in my courses I present all the underlying studies and this sort of thing. Most doctors don't know this. In the only study of, in this case, medical students in 2002, fully a third thought we had the highest life expectancy, and a third thought we had the lowest infant mortality. And there's Agrawal. He's one of the authors that Charlie knows. We don't do so well. Bad news. Yes?
I'm wondering about mental health and how that affects this. Because one of the things that the U.S. prides itself on is its exceptionalism, which you're kind of disputing. Yeah, we're exceptional, or we're exceptionally bad.
Yeah, so by almost any study that compares mental health among countries, we have the most mental illness. WHO study that looked at 18 countries with year-long in-depth family interviews. We had 26.4% of the population that had experienced significant mental illness in the previous year, more than any other country. We also have the most treatment for mental illness, which says something. Yes?
We haven't touched on access to health care and health insurance. Of course, our group is focused on single-payer national health insurance, right, where every resident in the country is covered. And if you compare our country with all those other countries that are way ahead of us in the Olympics, they have much easier access to care.
It was very hard for me to sort of come to grips with the idea of how much does healthcare do to improve health of populations. And I was either going to talk about healthcare and health here, but you said no, talk about inequality. And so I can quote some monographs, I can quote some studies, I can mention egregious things like what happens when we go on strike. I can quote, there's only one published study that looks at the impact of universal health care on the health of a whole society. And the results, I mean, I don't even want to say this because you're going to sort of start throwing things at me. Health care doesn't do as much as we think it does. And I can substantiate that in many ways. When doctors go on strike, the review says morticians have less work to do. This is not to say that we should stop working, but it does say that we have to look elsewhere to understand health in societies. You know, as an ER doc here, I could treat illness and injury, but the lack of health care wasn't the cause of the illness or injury. That's what we got to address. So you said being poor. Somebody said, yes, please.
But not having health care can cause somebody who has a fairly minor condition to postpone getting care. And how big of an issue is that when they finally have this catastrophic need for care?
So in my classes, I review the studies on healthcare and health. In this country, RAND Corporation, Research and Development Corporation, based in California, did a 10-year study starting in the early 1970s in which they randomized 5,000 people into one group that had as much as they could possibly consume of health care, and the other group had almost nothing. Mortality rates in 10 years were no different.
But these are all healthy people who are employed, who are much less likely to...
So poorer people are going to have poorer health. Studies, as the debate about the Affordable Care Act was heating up, you took people who, there's no question that people who in the United States who have health care insurance have lower mortality than those who don't. Once you control for poverty, you control for behaviors, you control for a whole bunch of things, the curves don't, then it's roughly a wash. We should have universal health care, but if we look at all the other countries that have universal health care, they still have the health inequalities, and they know it's not health care because everybody has access. Here we don't. So we think it's health care, and so I'm suggesting, yes, we have to wait before everybody's insured, before we have universal health care, and look what's happened in the subsequent decades and then scratch our heads, because we're still going to see the same health inequities that other countries see. It's not health care. It's important. I consumed a lot of health care last year, but it's not the big thing we think it is. Yes?
Well, of course, PNHP always points to the study that it was involved in out of Harvard that showed that 45,000 people a year died simply because they did not have health insurance after control.
David Himmelstein and others, yes.
You think that's a
okay. So, yes. Well, whenever it has been studied, medical care is always one of the leading causes of death. If you look at and now it's starting to appear in the public's eye. If you look at, and I have this, if you look at U.S. News and World Report, Best Hospitals for 2015, current issue, on page 73, when they talk about quality of care, they point out that a study last year showed that 446,000 deaths a year occur in hospitals from mistakes. Now, that's large. Then that doesn't count the people who die outside of hospitals, and that doesn't count medical care done right that still kills. Yes?
If you take a small group like the mortality rate, maternal mortality rate, how do you answer the fact that we are so high, and might it not be related to medical care?
So, for pregnant women, they can usually have access to some medical care. And yes, you can have obstetrical hemorrhages and you can have these other things. And that's why Adam's question about the causes would be important. Studies by Wadwa at UC Irvine and a bunch of others have and a number of other studies have looked at stress as the major cause now. And the United States, Stress Olympics, we're the 4th highest country in reporting stress. This is self-report stress. We have no good measures. You can measure, cortisol is a very good measure of chronic stress. And the hair shaft deposits cortisol in the bulb. And we're now doing studies where we take hair and it grows a centimeter a month, and we section it and we see how much cortisol is in that. And a study done on people with a myocardial infarction, their cortisol in the hair was going up, boom, and they had their heart attack. I mean, it's sort of cumulative stress over 3, 4, 5 months. And a whole bunch of other studies like that. There are people at the University of Washington right now that are doing a lot of cortisol in hair shaft studies. And maybe in the future we'll be banking hair as a biomarker for how we're doing. But we're not doing it yet. Yeah.
A couple of things, I guess, beside not having health care is an additional stressor, extreme stress.
Yes.
Choose our jobs. That's an extreme stressor. So factoring that in, and you said medical mistakes, how many and where per year?
Well, 446,000 is the study last year in patient safety.
But also, going back to a study that I read, when Canada finally took and started their universal health care system, we had similar infant mortality rates in the United States and Canada, but theirs dropped dramatically. Now, isn't the basis for your life expectancy that mortality rate as well? Doesn't that calculate in? So I'm still confused about your saying health insurance doesn't have is a major factor when I actually think it is. From these.
I mean, you're not going to believe me, and I don't expect you to. But let's look at how important is medical care? Let's go here. So here's this Time magazine article last year. Here's our expenditure in 2010. There's our life expectancy and our rank and infant mortality and stuff like that, the kind of stuff I was presenting. So you go to a monograph like this one from the University of Michigan, Making Americans Healthier, Social and Economic Policy is Health Policy. Page 4, they write, as dramatic and consequential as medical care is for individual cases and for specific conditions, much evidence suggests that such care is not and probably never has been the major determinant of levels or changes in population health. It's not. Okay. I knew we'd get into this.
I'm wondering about...
I don't want you to stop doing what you're doing. But
I get the whole thing about stress, but I've also been reading a lot about toxicities and how they affect people and how they stress us physically. They contribute to mental illness and to decreased mental ability. Most coal plants were located in areas where people of color and people who had really, low incomes could afford housing. the fracking, the whole business about fracking and all of that. I think those are really huge things. And
it's very hard to demonstrate the impact of environmental causes on health of populations, except for a few sort of egregious things like Minamata disease in Japan in 1957 with mercury and stuff like that. The time that it matters most. So I basically said we're dead first among countries. I've alluded that medical care isn't a big part of that. The piece that's really important to understand is that as we go from the erection to the resurrection, roughly half of our health is programmed in the first 1,000 days after conception. That is, early life is the critical period when our health is sitting in this room has been programmed. Societies that are healthier privilege early life. How do they privilege early life? Well, in a variety of ways. We mentioned Sweden. In Sweden, well, there's only 2 countries in the world that don't have a nationally mandated paid maternity leave policy. Papua New Guinea, half of a big island north of Australia, and the United States. Take Sweden, where we pointed out. It is mandatory to take a year's maternity-paternity leave at full pay. You can't get out of it. It's that bad. And if the mother takes the full 12 months, the father's got to take three months. The pay is paid by the Swedish government because the Swedish government has huge tax rates. And in Sweden, the second year of maternity-paternity leave is optional at only 80% pay. And if you decide in your 3rd year to go back to work, you can put your child in a Swedish government-run daycare center that's free. And to work in a Swedish government-run daycare center, you have to have an advanced degree in play. Because what's daycare all about? It's socializing the kid when they're 3. What do we do? Well, we outsource parenting. Moms go back to work in a week or 2. They have to. And it's killing us. Toxic stress. Poverty is a toxic stress in the first year of life or in utero. And until we recognize that, we're not going to make a change in our health outcomes. Let me just show this slide because this is Minnesota Department of Health, the Public Health Department this year puts out a determinants of health pie chart. And they give clinical care 10% of health status, 40% to social and economic factors, that's what I'm saying. Genes and biology, not very much. Physical environment and behaviors, 30%. This is the kind of thing I think that health departments are starting to flex their muscle and realize the population has to realize what produces health in society. And you might look at this this is medical care. The water's overflowing and we're mopping it up instead of going over there and turning off the spigot. I hate to say it, but that's my take as a doctor. So I haven't talked about inequality at all, and I was going to get there, but let me go to this. The healthier countries spend more money on social expenditures and less on medical care. So here's a study of this bar is social service expenditures and this bar is health care expenditures. Notice the healthier countries, these bars are huge except for us. And if you look at a ratio of it, we have the smallest ratio of social service expenditures to health care expenditures. We put our money into fixing, it is easier to build strong children than to fix broken men. Okay, I wanted to talk about, or I thought I was going to talk about, the link between inequality and health. And I want to start by this. I don't know if you read the New York Times Magazine, but last month they had this issue on all the research findings that are making us younger and younger. And they had this little call out, which I think was really telling. It was, being poor is really bad for your health. So my advice to you is, and the advice you should give to everybody is don't be poor. Or if you're poor, don't be poor for very long, and especially don't be poor when you're very young. That's the critical thing. So there's something called the socioeconomic gradient. Poorer people have poorer health. I saw it here in the ER all the time. It was the poor people that came in with the worst problems, and they didn't get better. So that's true everywhere. If you had a first-class ticket in the Titanic, you had a 60% chance of survival. Second-class ticket, 40%. Third-class, 25%. So always buy a first-class ticket. Okay. So this is the book that you mentioned back there, The Spirit Level. I have been following these ideas now for 19 years, the relationship between economic inequality and the health of populations, and it's an incredibly strong relationship that we have to acknowledge. And this book by Wilkinson and Pickett I use in my courses that I teach. It's a good read and it makes sense. Their basic argument is in this graph. If we take countries, rich countries, 23 richest countries, and we graph them between low and high income inequality, and on the y-axis we put z-score indices of all of these good things or important things. Forget what a z-score is, other than it takes units out of these measures and allows comparisons. So what you find is here's Japan, low income inequality and low index, meaning they have good outcomes on all of these things. There's the United States, in case you didn't spot it, that has high inequality and the worst outcomes for all of these. And I was just showing you, life expectancy and homicides and a few other things. I could go through all these individual data, but that's really true. And so if the Wilkinson and Pickett argument is to be believed, then it is now, this book has sold over 200,000 copies in the English edition. It's been translated into 25 languages. It was brought up in the House of Commons and by the Prime Minister in England. It's getting a lot of attention, but we refuse to consider it here. So I wrote this article for David K. Johnson's book, and I titled it Inequality Kills. And how much does inequality kill? Well, a study done at Harvard said it was a meta-analysis that we lumped all the inequality studies together, and we asked the question, suppose how many fewer deaths would there be if we had the income equality of the most equal countries, mostly Scandinavian countries? How many fewer deaths would we have every year based on this meta-analysis if we had the income equality, a Gini coefficient of 0.3 or less? Forget what that means. We would have 883,000 fewer deaths a year. It's about 1 death in 3 is their conclusion. It's like we have 1 death due to inequality in this country every 36 seconds. Now, it's just a different way to slice the data, but these are robust findings. If you look at, there's about 300 studies now on income inequality and health, and 70 to 80% of them show this kind of finding. And the Institute of Medicine's report also points out that income inequality is a major factor. So, what are we going to do about this? So let's go, if you grant me that inequality is killing, and the evidence is very strong, and it's killing a lot. It's an example of what Paul Farmer calls structural violence. That is, violence is injury or whatever, and it can be behavioral violence. The smoking gun, that's behavioral violence. That's the trade towers collapsing. Structural violence is violence due to the structure of society that kills by the usual diseases. There's no smoking gun, no individual perpetrator, and we don't see it that way. It's like inequality is a highly toxic, odorless, colorless gas that pervades our society and kills us from the usual diseases, and we're unaware of it. It's like health would be in this country if everybody smoked, and we never thought of smoking as a cause of death. That's inequality. Yes?
Can you explain why inequality causes death but poverty doesn't?
I didn't say poverty didn't cause death. The two are linked. We have so much poverty, and we only have so much poverty because we have so much inequality. Basically, psychosocial comparisons that we make stress us out. Richer people can have access to all sorts of things that their money can buy, and they gloat on having more than others now. It's very different than it was in, say, 1960. And they have is healthcare. Yeah, they have healthcare, sure. But so do the people in the middle, and they're still dying younger. So psychosocial stress is one of the major mechanisms that inequality kills. And I could get into a long stress biology lecture, and I can present a lot of material there. It's hard for us to think that stress is a killer. It's not brought up much in medical school. But those of us who practice understand how it sort of pervades ourselves and the patients we see, and it's affecting young people more and more. I teach undergraduates, I teach graduate students. I've been doing this for decades, and they're more stressed out now. They have more conveniences. Life would appear to be easier, but they're constantly talking about stress. I did a nominal group technique on with my students on how to deal with the high amounts of stress. What can the university do to deal with high amounts of stress? And several students said, have places where we can go and pet animals. Yep. The students pick it up. They know, and they're desperately trying to cope with the stress in our society.
Wouldn't some say that stress is good for GDP?
Yeah, maybe. Good for GDP. I mean, okay, so that's another argument from Wilkinson and Pickett, and that is they call it the convenient truth. Namely, we've got all we're ever going to need out of economic growth. If you look at countries, once they reach a certain plateau of about $10,000 per capita, more growth doesn't improve things. If anything, it tends to make us worse. There are studies showing that, lots of studies, that during periods of economic booms, remember, more health improves, the health improvements are less than during busts. Why would that be? Why would we do better when the economy is tanking than when it's growing? Well, when rewind back to 2008 and people were out of work. They were worried. They weren't working. They weren't they lost their jobs, or they weren't. Road rage was less. The Harborview Trauma Center was empty. I mean, it wasn't empty. The census was way, way down because people were not crashing into one another and shooting one another. Suicides go up during busts, but not most causes of death. It's a different. Once you begin to think of the population as the patient, and you begin to consider what affects your patient, namely the population, you come to different conclusions than what affects the health of an individual. Yeah.
It would seem that when people are out of work, they're going to be more stressed. That probably doesn't make sense.
If a few people are out of work, they're more stressed. But once a lot of people are out of work, then there's the collective nature of it. And think back to the Great Depression. Buddy, can you spare a dime? They worked with one another. It was a cohesive community of people all stressed out. And Japan is an example of a society that is so stressed. But everybody's stressed in Japan. And so that collective social capital is different. It requires looking at it in a different way.
Yeah, certainly lack of health care access and lack of health insurance will increase stress.
Oh, amazing. Yes, absolutely.
After poverty level, over 50% of bankruptcies are caused by.
That's correct.
It's certainly a high stress factor.
Yes.
I think it rates amongst the top 3 of stress factors. So certainly lack of health care access.
I mean, it's crazy that we don't have universal health care. It makes no sense. But I would offer that it won't change our Health Olympics picture, much as we want to believe it.
What are you going to do? You get a highly stressed patient in the U.S.
So what did we do in the what did a Republican president propose in 1969, August 8th, 1969? President Nixon proposed a guaranteed income for all American families. It's called the Family Assistance Plan. And guess what? The newspaper editorials, the TV programs were 95% in favor. We thought it was a great idea. Give everybody money. If poverty was a disease, you'd write a prescription for money. And that's what Nixon was trying to do. It passed the House of Representatives. It languished in the Senate. Nixon got embroiled in Watergate, and it was over. There's a good book on that called Nixon's Good Deed, published by Yale University Press. So remember, the values then were different. We had this sense of taking care of people. There wasn't this focus on the individual and greed is good mentality. And we've had a tremendous value shift in this country. And people are now, they think that there's something wrong with our values. We're not, we have these international students who come here and they just can't believe the homeless all on the Ave. And they said, boy, it's not like this on the TV programs we see about the United States.
Yeah, right.
So where do you start? I would argue that you start with health care. And if you get that domino to go over, it can help move the other domino.
Okay. So, what should you do? Well, do what you're good at. Do something at skills. Do something you enjoy. And do something that doesn't require you to make money off it. So I'm good at teaching, writing, talking, and I try to develop those skills. And I try to look at the population. You people should continue to work on pushing for a national health care program, just what you're supposed to do. You should also recognize that inequality is the key factor you're trying to address. Whether it is trying to deal with the stress of not having health care, which I think would be huge. Address these things, but also in the back of your mind, recognize two things. One, inequality is killing, and when it matters most is in the first 1,000 days.
One more thing I'm kind of thinking about here. We have entered into a coalition with a group of people, others who are interested in healthcare, and we've been kind of pushing the concept of healthcare as a human right.
Absolutely.
And I think that the thing that is so attractive about that is that people respond to it immediately. Also, it brings us to a place of compassion. So that if we think about it being a human right, we think about when we provide that, it will make us better people. We'll be more compassionate, and possibly we can scoot in under the radar, and if compassion grows, we'll see the oligarchies begin to crumble.
You got to remember, there are only two superpowers left in the world. One is about 1 million people who are rich and powerful, and the other is the 6 billion of us who are a huge superpower. All we've got to do is flex our collective muscle, and the rich are just they can't stand up to us unless they launch nuclear weapons. Yes.
I was bumping into a guy from, I believe it was Holland or someplace that had universal health care, and I mentioned to him that we don't have any such a proliferation of bankruptcy due to primarily medical bills. We don't have half of our foreclosures at different points that are due to medical bills.
One of the most commonly prescribed prescription drugs, it varies from year to year, is alprazolam, Xanax. I mean, that's, we consume half of the world's Xanax in this country. And that says something. Yeah.
Well, our economic system thrives on insecurity, particularly in this country.
Yes.
I mean, it's been exaggerated and extent intentional. They don't want to comfort us and make us feel a little easy when we go to sleep at night.
But that was different in the 1960s and the 1950s. And so we've had this mentality of, I got mine, you got to get yours. We won't do it together. There Let me just quickly, I don't know how much, okay, so here's the stuff I said. We got to focus on the first 1,000 days. All our policies have to have the impact. A student of mine came up with this graphic. She did an Ignite talk at Town Hall, and she was talking about the first 1,000 days. We've got to recognize that a girl is a mother from the time of her own conception. It's not what we do when she gets pregnant in antenatal care that matters. All the research points to the lifetime history of the woman before she becomes pregnant matters more for the health of her baby and the adult that becomes than what we do during those 9 months. Lots of studies show that if you build strong children, I mean, this is James Heckman, a Nobel Prize winning economist, just published in Science just this spring. It says, look, you put money into early life and adults are going to be healthier. So, spending money on families in early life is really important. And this is just a graph of spending by the age. Sweden spends more money on the first year, more government money on the first year of life than in every subsequent year. Where do we spend our money? Government money. People my age and older, we vote. So here's our spending, and there's Sweden's. That's got to change in this country. I mean, we know where we have to target the money. Child poverty, just huge. Federal child spending is going down. Paid leave for new mothers, United States and Papua New Guinea. I mean, so basically, what did the Institute of Medicine report say needed to be done? Shorter lives and poorer health. First thing was tell the people. Namely, inform the public that we die younger than people in all the other rich countries. Then look at healthier countries to see what they do that could be of use here. Look at healthier countries to see what they do that could be of use here. Now, that's very un-American because we tell the world what to do.
In this country, 50% of all deliveries are paid for by Medicaid, which means half of the babies are born into at or near the poverty level.
Right.
And what happens to those children from day one of conception through the first 3 years is horrendous.
Yes.
In terms of what those moms can do for those kids compared to what you and I did for our kids.
Right.
There's no contest. And so it doesn't surprise me that that turns out to be a very leading variable. Yeah. It affects what happens in schools, careers, attitudes. It's all formed in the first couple of years of life.
Absolutely. So we have studies, for example, clinical trials, showing when first studies published in JAMA in the 80s showed that if you had a nurse visit a pregnant woman, Medicaid woman, every week, and then continue to visit after the child was born, that they had good outcomes, later in life. Then we did a number of trials comparing one where you had just the usual intervention and then the nurse intervention, and you looked at in the trials the outcomes were far better, and these are called nurse-family partnerships, and well documented. But we spend 25 times more money on pushing for Head Start and these kind of remedial programs. They're not that we shouldn't, but here's something that really works, and we would prefer to have a technological solution rather than paying. Rather than there's so much to do with poverty: nurse-family partnerships, cash transfer programs where you treat poverty with money have been shown to work. We don't want to do that. I mean, once you ask the question, what should we do to support early life? I mean, paid leave is one thing, but there are so many others that have lots of evidence behind them that the other countries do. I mean, in Sweden, there's no such thing as poverty when you're a little baby. Yeah.
And then there's the availability of effective contraception, which we totally don't even talk about.
Yeah.
But the statistic you had about 883,000 deaths due to the inequality, that's somewhat of a new kind of a look at the statistics. So if you have a corollary study that shows a commensurate change, what's the percentage change of these kind of deaths due to inequality when a universal healthcare system in all these different countries, more than 30 countries, have introduced?
Do you know that after Medicare was introduced in 1966, they could demonstrate no mortality benefit in the next 10 years? The expected mortality before Medicare is what went on. Didn't seem to be these are people 65 and older, but there did not seem to be a big difference.
Too late to change the
Sorry?
But the people who got the stress relief from Medicare were the adults in their 40s and 50s.
Didn't make much difference then, right?
Well, over 10 years maybe not, but
Yeah.
it would be interesting to see how that played out further out.
What is the research on the impact of universal health care on health? Ask that question. And then try to find studies on it. There's only one published study, and that was done in Winnipeg, Manitoba, over a period of 20 years. And because of budgetary limitations, they were cutting the cost. They were cutting healthcare services in Winnipeg, Manitoba. The more services they cut, the more health improved. And this is their conclusion. Okay? To conclude, a universal health care is definitely the right policy tool for delivering care to those in need, and for this it must be respected and supported. However, investments in health care should never be confused with or sold as policies whose primary intent is to improve population health or reduce inequalities in health. Claims to that effect are misleading at best, dangerous, and highly wasteful at worst. There is no other study that I've been able to find that asks this question: what does universal health care do to the health of populations? Again, I'm not trying to tell you that we shouldn't have universal health care. It's incredibly important. But I think this conclusion puts it very well.
So why is it important? Why is it important?
Oh my God. I don't have to tell you that. When you need to, when you have an injury or an illness, you want to be taken care of. And for all its faults, medical care tries to do that. And, as an ER doc, I saw just about everything you could imagine. I had a woman walk in here at 3 a.m. on a Friday night, Saturday morning. She walked in and she said, she's an attractive woman in her 30s. She said, "I'm not happy and I want to be admitted." They come with everything. And we are the final common denominator. There's nobody you can't turn away. We may not be the right people to address her unhappiness, but yes.
Now, in our state, we have sort of a universal health care for kids.
Mm-hmm.
So you would say that would be...
Which is undersubscribed.
And if we took away veterans, which is a socialized health care, if we took away all of that health care, that would improve, supposedly, the state of veterans.
They're outrageous. I don't expect you to believe them.
The way Medicare, would we be improving?
No, we need medical care. We need universal health care. When I make the statement, we have to recognize that medical care can do a lot of good, but unfortunately, it does harm too. And those of you who practice long enough know you've either harmed people or been harmed by medical care. I mean, it's unfortunate. I remember in this medical school class at UW, they had clinicians from the city come in and they talked about their harm they did. And I remember one person said, "In your life, you will kill 4 patients." Okay. I mean, I got myself into this hole, didn't I? Yeah.
I would argue that the impact of universal health care now in America would lead to a sea change in public opinion that could lead to greater willingness to consider other stress reducers.
I'd buy that.
I think, in answer to David's question, I think we work in universal health care because we believe it's a human right.
And I agree with you. Yeah.
Well, I'm a retired pediatrician, and I think and I was a primary care pediatrician, what's more, and so that's what we need is primary care pediatricians to take care of those babies once they arrive.
And as a matter of fact, and like I said, I tried to tell you that the whole shooting match doesn't appear to improve health. Many studies show that primary care focus is the good part of medical care and that you see mortality benefits. So you're absolutely right. If we focused on primary care, The existing studies all demonstrated benefit.
Deep down, all Americans view healthcare as a human right, because when you ask them, unless they're really, in your face in an argument, if somebody is bleeding and shows up at an ER, should we tell them to just please go die in the parking lot because you can't pay? And people say, no, we can't do that.
Think about the 911 response system. That's socialized medicine in its purest form.
Chicago.
Yeah.
Their salaries and aid cards and benefits are paid by the taxpayer. And nobody would want to turn it over to the market. Because they know when you're in a jam, you don't want to have some clerk tell you, sorry, we don't have you as a subscriber. We'll give you the number of the local cab company. Society wouldn't deal with that. And that's the purest form of socialized medicine.
It's a great argument.
Right, but that I see it as an illustration of the underlying moral view of people. I think not just in the United States. I think we're probably at the lowest possible edge of that. But world over, oh my God, if that person needs health care, they've got to get it. And you don't. And so everything else would fall from that. Well, if we're going to do that, then we might as well do it in a way that at least does it in a rational fashion. So anyway.
So universal health care would represent a significant transfer of wealth. And so would that make much difference in terms of economic inequality?
Probably. I mean, how are we going to impact economic inequality in this country? Remember back in 1960, for every dollar of tax you paid, corporations paid $1.50. Now for every dollar of tax you pay, corporations pay 25 cents. So if the corporations are going to pony up and do that, that's going to increase. So we've got to, in one sense, take the top down. Seattle's also passed a minimum wage law, a livable wage law, and in the last election, 3 or 4 other cities have passed similar laws. So we're trying to bring the bottom up. And it depends on what we're good at working for. And the livable wage movement has started. Obama has tried to sort of, increase taxes slightly, but it's remarkable how poor people don't want to see tax rates rise because they believe before they die they're going to strike it rich and they want it all. I mean, it's really a very strange situation. And so go back to we need to talk to people about these ideas, and it takes a long time. If I think about the courses I teach, at the end of a quarter, the students in the courses I teach have to take the ideas out of the classroom, create a community event, and seed them there. And some of them like it so much that they keep doing it afterwards, and I hear from people years later. We've got to get good at presenting these ideas. They have to be exposed to critical thinking. You see, I don't know whether you're going to believe much of what I said, but you did hear a lot of back and forth, and I think that that's really important. More important, too, is to put it into schools early in life. Suppose in kindergarten or grade 1, we pointed out that we're dead first to everybody. Suppose, almost nobody knows we're dead first. If they did, we'd start to want to do something about that. Because all things being equal, on your deathbed, would you say, thank God I lived a shorter life. I wouldn't want to live a longer one. No, of course not. But that's the situation we're in, and we don't know it.
I think we're getting down towards the last questions because of our time, but you are the chair of the Washington Physicians for Social and Inequality. Could you put what your plans are for the coming decade?
We want to write a strategic plan. We've supported a few events. I think we're in the phase. I just joined the board earlier this year, so we're in the early phase of trying to figure out how we're going to seed the idea of inequality being a killer. And that's hard. I can talk about it to a group like this. I can do a TED Talk. I can write newspaper op-eds. Each one advances something a little bit, but I think I get the most throughput when I go to grade 6, 7, 8 classes in school or high school. I was up at Nathan Hale. I go to Evergreen School. I had a student who did a month-long module for grade 6 girls at Seattle Girls School. That's where I think you can have some impact, is with young minds. And that's a real challenge. It takes, your school board, trying to change a school board to present material is really difficult. Laura Skelton here made a very good teacher's book for schools that included some of these ideas. But getting school boards to adopt them is not that easy. So there are lots of ways that they're all incredibly challenging. But, what do you have some skills at, and what do you enjoy doing that can reflect So all I'm saying is put inequality into the discussion about universal health care. If we had hired, how many have heard of the book Capital in the 21st Century by Tomas Piketty? So R is greater than G. The growth in capital is greater than the growth of income. So inequality is going to diverge more. That's his basic argument. What does he say we need to do? We need global transparency on incomes, wealth, and inheritances, and we need to tax those. And with the tax that we collect, there's so much money to fund universal health care and early life and all the other things. California newsreel. How many heard about unnatural causes? Is inequality making us sick? It was a series that came out in 2008, a 4-hour series. They're coming up with a new one on early life, the making of America. Raising of America. Right. And so, what my students do is screen, the unnatural causes for audiences and then carry out a discussion. That's how they get their feet wet talking about these ideas. And, the video is very compelling. And it's now online, I think, without a password. Well, thank you all for your attention. I'm really glad